we are seeing less patients than we were prior to the pandemic. I think people took the stay-at-home order to heart, and unfortunately, I think many people may be staying at home when they have life-threatening conditions where they should be coming to the emergency department.
Something that we've actually seen is while we've had a decrease in the amount of routine emergencies that our folks are running day to day, is we're actually seeing an increase in the amount of the acutely ill, or what we would consider the sick patients that have kind of waited a lot longer than what they probably should have to call 911 for us to be able to come out. Everybody has different tolerances for what constitutes an emergency with them. Our recommendation would be that anything outside of the ordinary is trust your gut. If you feel that something's not right, call 911 and we'll take it from there. But some of the big ticket items, anytime somebody has any type of chest pain, any type of trouble breathing, it's even more important for them to get evaluated at an emergency department so that they can get the care that they need.
So in the emergency department, the safety measures that we have are that everyone is getting their temperature checked upon arrival. Everyone is having a mask applied to them, whether they're an employee or a patient. We are obviously separating patients that may have COVID versus non-COVID patients. We have strict visitation restrictions at this point. One parent is allowed with a child, and if you're an adult, you're not allowed any visitors in order to help decrease the possible spread of COVID-19. We have plenty of PPE with N95s, surgical masks, goggles, gowns, PAPRs if we need them, and those are the safety measures that we have in place.
Our folks are going to look a little different than what they have in the past, and a lot of that is based on us protecting ourselves with an increased amount of personal protective equipment. You can expect to see our folks in masks and glasses and some type of gowns over top of them, which is a little bit different business for us than what they may have seen in the past. So that's to help protect us from the patient, but also to help protect the patient from us is probably they should expect to have a mask placed on them. The most important message that on behalf of Loudoun County Combined Fire and Rescue System that we could give to the public is that we're all in this together and it's safe. It's safe for you to call 911. Our providers do what's required of them to protect themselves from the patient, but also is to protect the patient from our providers as well. The day-to-day look of what you may think a paramedic looks like has changed in today's environment. And a lot of that is based on the additional personal protective equipment that our folks are going to be wearing. So while we look a little bit different nowadays, is just know that it is safe, and what we're doing is to help protect our providers so we can continue the service that we're providing, but also to protect the patient from us because of the amount of folks that we're around that are actually sick with COVID.
StoneSprings Emergency Department is open. We are here for you. We're seeing everybody, not just COVID-19 patients. So if you have chest pain or abdominal pain or have injured yourself, stroke-like symptoms, anything, we are still taking care of all patients, and we are open and we're happy to help.